This is Indra Cidambi from the United States of America. I'm a psychiatrist. I'm going to talk about paraphilia, voyeurism, and voyeuristic disorder in this video. Before we jump into this topic, please don't forget to subscribe or press the bell button. All right, let's jump right into this video. I would like to answer a few of the questions that is being raised by the viewers. So let me look at these questions first and try to give a direct answer, right? So is desire for doing or receiving oral sex a psychological issue or abnormality? So receiving or giving oral sex is not a paraphilia, and it is not an abnormal act of a sexual desire. So it is considered to be norm within the normal practice of sex. Sex and food needs to be desireful, right? So when someone wants to have oral sex, as long as the partner is agreeable and there is no force, there's no just the ritual, and then it becomes little, distressful. So if it is within the norm, oral sex, giving or receiving, is considered to be a normal act of sex. The next question is, why some people always like to have sex with older women? Is it a psychological issue or a mental disorder? So once again, my friend, having sex with an older woman is just a preference. It's not a psychological disorder or a mental issue. It is something that a person prefers, right? And it's absolutely normal to like someone who is older than you to have sex with. That could also be that that person is much more matured, or they are more desireful and more fulfilling with the sexual act. So it's just, once again, how that person prefers. There are some drugs that increase stamina and desire. How safe are they? Absolutely. The desire or a stamina pill that men take is okay, as long as you don't have other illnesses like high blood pressure or any organic other side effects with the drugs that you're taking. So it is advisable for you to talk to your doctor and make sure that you are okay to take these stamina drugs. Just buying it online and using it blindly is not advisable. But otherwise, taking those medications are not a pathology. Why some community is always towards rape and creating problem all over the world? That's funny in a way. It's not the community. It is the personality of certain people. What you're exposed to, what is in the environment, what is in the cultural belief, all these things add to the practice of a person. So we are constantly learning from an external environment. So when we have an environment which is more volatile, then these kind of behaviors are seen and they become troublesome. So it is the template that we learn from. All right, so that is the only way that I can say certain communities accept violence, certain communities normalize the abnormal behaviors, and if you are brought up in that community, you start thinking that that is the norm. So that makes it troublesome for other people around them. Is cheating a paraphilia? Absolutely not. Cheating is not a paraphilia. And so we want to look at it as the behavior itself and want to find out, why is this person cheating, right? All right. Is a rape considered as paraphilia? No, absolutely not. That is a problem. It's a legal struggle. Many psychiatrists are trying to manipulate the paraphilic disorder diagnosis to address this rape as a rape paraphilia, and it's not. It's a crime. It needs to be legally punished and taken action as a legal issue. It's not a mental issue. It's not a paraphilia. All right. On that note, let's really jump into voyeuristic disorder and voyeurism. So after I have answered all those questions, feel free to send me more questions, and I'm happy, more than happy to address them in my consecutive videos here. All right, let's dive right into voyeuristic disorder. Voyeuristic disorder, what is it? If someone is sexually aroused to the urges, the fantasies or behaviors of watching someone getting naked or disrobing, or someone who's already naked, and or someone engaging in sexual act, any of these is considered to be voyeuristic disorder, right? Sorry, voyeurism. So voyeuristic disorder meaning when they act on these kind of urges or fantasies, and that causes distress to that person who is a voyeurer, that means who's peeping Tom. The voyeurer is a peeping Tom, and if he is going to be affected, if he is going through the distress, then that person has voyeuristic disorder. And also they have acted on this by really peeping in and sometimes take pictures, videos, and those are hindering themselves and also harming others. And also they distribute these videos. Then it becomes absolutely, a crime, right? So voyeurism is an act, and when it really affects the person who is a voyeurer, it causes distress in them and or causes more functional disability, inability in all areas of life, occupational, environmental, psychological, in all areas of life, then that is considered to be a voyeuristic disorder, right? When they hurt themselves and they hurt others, right? So then we call it a voyeuristic disorder, and it is a paraphilia. So what's a big deal, right? If somebody is peeping on the unsuspected person at a stretch for a 6-month period or more, then the diagnosis is given to them, right? So the unsuspected person does not know that this person is peeping when they are naked, when they are disrobing, or when somebody is having sex. So most times they don't get caught and nobody knows. And also the voyeurer does not want to have sex with the person that they are watching, where the peeping Tom does not have any desire to have sex with that person. But when they take a picture and they start distributing, it becomes a real issue. There is a criminal thing. And these people who are suffering from voyeuristic disorders, they don't seek help. They only get to ask for help when there is a criminal act, when they have been caught, right? So it is also associated with other paraphilic disorders like exhibitionism, and also with substance use. When someone is drinking or using stimulants and or using some kind of drugs, what happens is it disinhibits them, and so it becomes more easier for them to act on their urges, fantasies, and the impulsivity that they get. Then they go act on it by finding places where they can easily peep into. It could be the public bathrooms that they can peep through, or it could be somebody's bedroom windows that they can peep into. In these days, because of such an accessibility with the social media, people with their cell phone cameras and or having video cameras implanted inside the mall where there is changing rooms. You could see that all the time. They say, hey, make sure that there is no hidden cameras. So those are the ways that people seek out for their arousal. They get aroused by doing this. That's the only way that they get the sexual desire fulfilled. This is most commonly seen among ages of 18 and above, and in adults. As we age, once again, by age 60, these behaviors tend to tame down simply because of the testosterone. Voyeuristic disorder, as any other paraphilic disorders, are more commonly seen in men, but that doesn't mean women don't have it. But we do have less women engaging in such activities. So voyeuristic disorders, what can be done? Why are they getting this? This is because accidentally someone gets to see their parents engaging in sex, and then it gives arousal to the child, and then they become victim of this voyeurism. Or it could be because accidentally they ended up seeing someone naked, and so that becomes a root cause for this. And also hypersexuality could be a root cause, and the substance use could also lead to voyeurism. So voyeurism in itself is not a paraphilic issue when it becomes a distress to themselves and impacting on their functionality, and also it impairs their day-to-day activities. They would constantly forego any kind of personal activities in order to engage in this kind of voyeuristic behavior. And also they impact a lot of problems onto those people who are unsuspected, naked, or who are engaging in sexual activities. So then that becomes a voyeuristic disorder. In the brain, there is the serotonin, low serotonin in them. So what can be done? How can this be treated? This can be treated by giving psychotherapy, cognitive behavioral therapy, obviously, and also medication like leuprolide or medroxyprogesterone. So the hormonal treatment is the way to go. It is a crime, and it has to be really caught very early. And it is never a person who's suffering from voyeuristic disorder comes to a doctor's office or to a therapist asking for help. It's because of their spouse, or it's because of the legal reasons they have been caught for exhibitionism, or they themselves peeping into somebody's window, or when they are engaging in voyeuristic behaviors, they get caught, and it's a criminal offense in most countries. And that's when they have been brought for treatment. The early detection, and if you or your loved one is watching this video, and if you need help, please ask for one. It is treatable and you can take control over this. If you suspect it, please do seek help. Thank you so much for watching this video. Once again, I'll meet you with the next topic, which is the exhibitionism, a paraphilia. Up until that, bye-bye.